It is my great pleasure to be here today with Dr. Arun Nagendra, who is a postdoctoral fellow in clinical psychology at the Center of Excellence for Psychosocial and Systemic Research at Massachusetts General Hospital. And Dr. Nagendra is kindly going to tell us a bit about a recent publication that she just first authored. And let's get started. And I wondered if you could tell us a little bit about the background and the seeds for the ideas behind doing this analysis for this study.
Sure. Hi, Cori. I'm really happy to be here today. And I'm going to be talking about racialized disparities in treatment outcomes for people diagnosed with schizophrenia. And the reason I'm really interested in this topic is that because in the US, a lot of research has shown that Black individuals diagnosed with schizophrenia have significantly worse long-term outcomes than their white counterparts. So Black individuals are more likely to be incarcerated, unemployed, homeless, and also they have higher rates of psychiatric hospitalizations. But studies haven't looked that much at like what happens when Black folks come into treatment. These studies are generally about just kind of like long-term, broad outcomes, regardless of the care people are receiving. So the question I'm interested in here is like, when Black individuals are actually in treatment for psychosis, how do they fare?
Excellent. And I know that this study was a fairly large study and the largest and first of its kind to be conducted in the United States, comparing coordinated specialty care, which has generally been thought of as the gold standard treatment, and is comprised of individualized medication management, individual therapy focused on strengths and pursuing personal recovery goals, family therapy, and supported employment and education to support work and school goals. So I know that that was compared across 34 sites in the United States to usual care, where some of the sites received training in coordinated specialty care and implemented that, and some of the sites did what they usually do. And can you say a little bit about what actually the research question was and what kinds of things you were going to look at to see if they were different?
Absolutely. So the study looked at some of the data from this larger parent study. So specifically, we looked at about 300 people who identified either as non-Latinx Black or non-Latinx White, who had just started treatment for first episode psychosis. And what we did was we compared rates of improvement in a variety of different clinical outcomes like symptoms, quality of life, stigma, and self-reported mental health between Black and white participants in both of these conditions.
And what did you find? And can you say a little bit about whether or not you found what you expected to find?
Yeah, it's a really good question. So, I'm not entirely sure what I was expecting to find. I think I was expecting to see more disparities in outcomes than actually emerged. But our findings were actually quite promising. They show that there are actually very few racial differences in treatment outcomes over 2 years, regardless of the treatment conditions. There were two notable exceptions. So first, we looked at positive symptoms, which include things like hearing voices or believing things that are unlikely to be true, and found that Black participants showed less improvement in both conditions, so in both treatment conditions, than white participants did on this particular symptom domain. Interestingly, we also found some findings for stigma. So in coordinated specialty care, in this gold standard care, levels of mental health stigma decreased for Black participants. But in care as usual, stigma actually got worse for Black participants. For white participants, however, like the treatment condition didn't really seem to make much of a difference in their stigma levels over time. The stigma just kind of went down over time as expected.
And what do you make of this, that it sounds like treatment as usual was particularly damaging to Black individuals who received usual care? Why do you think that might be the case?
Yeah, there's like more and more research kind of coming out in this area that kind of shows this dichotomy. So there have now been a few studies that show when barriers to accessing high quality care are removed for Black folks, they actually show similar rates of improvement to their white counterparts on most outcomes. And this is great. The flip side is that it seems like when Black participants do not receive high quality care, they have worse outcomes than their white counterparts who are not receiving high quality care. So the cost of receiving less than optimal care seems to be worse for Black than white people. And this may be because without adequate support, racism-related stressors may disproportionately worsen mental health outcomes in Black folks with schizophrenia. So just as an example, in this paper, we kind of speculated that maybe the reason that in care as usual stigma got worse is because Black individuals, they've likely experienced discrimination and racism over their lifetimes, and they may be actually more attuned to experiences of discrimination. They may be more likely to notice discriminatory behaviors when they occur, like even subtle forms of it, like people maybe keeping their physical distance from them. And so, the experiences of racism they've had may impact and add this kind of like extra toll to their mental health that without high quality interventions may kind of add up over time.
Very interesting and very important work. It also makes me think a little bit about sort of differences between equal versus equitable care.
Yeah, I actually recently wrote a commentary about this. In many treatment outcome studies, what researchers do is they look at rates of improvement starting from the time that people enter treatment. And this is an important question. It's the one we asked. But what studies don't look at as much is whether disparities that may be present before people enter treatment or right when they enter treatment actually are eliminated by the end of treatment. So for example, if Black participants, in the study, Black participants actually had slightly worse disorganized symptoms at baseline. And we didn't look at like whether by the end of treatment that difference was still there. We just looked at whether Black and white participants improved in disorganized symptoms over the course of treatment at the same rate. And so this is a difference between examining whether treatment programs are providing equal or equitable care. To be truly anti-racist, I think, and to provide truly equitable care, treatment systems may need to actually offer additional reparative care to target disparities that start at like right when people enter treatment or before they enter treatment.
Thank you so much for sharing your work and your time.
Absolutely. Thank you for having me.